I am Josh Luekenga, Doctor of Audiology at Utah Ear Institute. Today we are talking about BPPV, benign paroxysmal positional vertigo. It's one of the most common types of vertigo. This is my lovely wife, Amanda, who got BPPV last night, and I decided to exploit her today, and we're going to use her as a teaching reference. And so she has BPPV of the right ear, the posterior canal, which is the most common canal just because it's most gravity sensitive. Majority of patients that we see will have BPPV in the right ear. So what we're going to do is we're going to do the Epley maneuver on her, and we're going to have her turn her head to the right, and we're going to have her lay back, all the way back. Thank you. And you can see here, that is called nystagmus, geotropic nystagmus, and that tells us which ear it's in. So with the head to the right and back, we can actually isolate the posterior canal so gravity affects it the most. And those little teeny otoconia, those little teeny pebbles, they go clear to the bottom. And now what we're going to do after we've done that, how are you feeling, Amanda?
Okay now.
Okay, good. You nauseous at all?
A little bit.
Okay, so I'm going to start tapping her mastoid, the temporalis portion of her skull, just to make sure we get all the rest of them. And as we do that, we're going to turn her head to the middle. Excellent. And we've already instructed her what we wanted to do as far as fixing this. So the Epley maneuver, we're going to rotate her head a complete 270 degrees in order to treat her. So you're not going to expect to see too much nystagmus or too much vertigo as you treat the patient. Oops, sorry, my hand's in the way. There we go. Perfect. And then what we're going to do next is we're going to flip her over on almost her stomach. She's going to go clear to her side. But the main thing is you don't want the patient's head to come up. You don't want it to come up during this next portion. You want to spin them like they're a chicken on a rotisserie. So we're going to have her go ahead and turn as much as she can. Perfect. Just like that. That's perfect. Excellent. And then the next portion we're going to do is she's going to sit up kind of like a windshield wiper. And as she does that, she may feel the tendency to rock back a little bit. And if that's okay, that's normal. Those little crystals are going to land right back where they need to go. Excellent. Dr. Cook's behind the camera. Thank you, Dr. Cook. And we're going to set her up in 3, 2, up she comes. Good. And then chin down. Good. Feeling okay?
Yeah.
Okay. Excellent. Now we're going to just check the work. Excellent. Head to the right. Come on back.
I'm not spinning.
You're hilarious. All right, and that's how you do that. Thank you. So now that we've treated, the instructions to the patient are to basically not move vertically all day. So there's no picking things up. There's no trying to fix things or look upward like you're looking at a building or up at a skyscraper or up at the sky. These types of movements are okay if they're lateral, if you're doing them nice and slow. But for the next 24 and even sometimes 48 hours, there's no vertical movements, and that should really solidify your treatment with the Epley maneuver.